Welcome to H&HN Daily. I'm Suzanna Hoppszallern, Senior Editor for Hospitals and Health Networks magazine. Adena Health System offers patient services in 13 counties in South Central Ohio. Physician alignment strategies have supported the growth of the rural patient care network. Today, I'm joined by Dr. John Fortney, Chief Medical Officer, and Jeff Graham, Chief Strategy Officer, to discuss physician-integrated strategies in a rural regional patient care network. Welcome, John and Jeff.
Thank you.
Thanks for joining me today.
Thanks for having us.
Thank you. What type of organizational structure and governance model do you use?
Well, so the type of organizational and governance structure that we use is a dyad model, which you see in other healthcare organizations, but it's really been successful for us from the standpoint of the ownership. And what I mean by the ownership is the physician ownership and the physician leadership piece that really has helped Adena grow. It's also helped with the partnership of the administrator and bringing down the walls, if you will, of transparency. Because at the table you have an administrator and you have a physician leader really deciding what are the next moves to make strategically, but also operationally. So it's been a very, very effective structure for us.
What's important in physician leadership for this type of a model?
Well, I think the things that we look for primarily are your ability to communicate. Because we found over the years that if we have a failing, it's lack of communication, both from physician to physician as well as physician to administrator or physician to board. And the other thing in terms of leadership is that you need to have proven yourself as a good clinical leader, if you will, in whatever specialty you're in. So it's very difficult to take a physician who's just coming out of training and put them into a leadership position, because many times you're judged by physicians not really on your administrative skills, but show me what you've done in the past. Right. So that, ability to communicate and good clinical performance are probably the top two criteria that we use. And then we just put them into different committees to see how they function, how the committee functions, then try to make them head of that committee so that there's the ongoing training through the committees till they get to the point that we feel they could take on a bigger job role.
And what are you looking for in a physician affiliate?
Again, there it's a little more specific. If we're looking at a physician or a group of physicians, first and foremost, we want to know what's the perception in the community they're in as to their quality of care. And if we can get specific metrics or statistics, then that's good. But then we begin to look at their financial performance. What's their payer mix? Does it fit with ours? Are the personalities ones that we see would fit into an employed model? So that some doctors are looking to do this not because they want to, but because they're financially strapped and they want better rates with the third-party payers. They don't like hiring and firing. They don't want to learn anything about business. Well, that's all well and good, but that doesn't mean you fit into a group setting where oftentimes, you're prescribed what you need to do based on the good of the group as opposed to the good of the individual. So we're very careful and, try to use behaviorally based interviewing with these people so we have some sense of what it's going to be like bringing them on board.
What about technology and the EMR platform? How important is that in terms of your network?
Well, that's key. The network will not function. If you look at a 13-county area, it's very difficult for myself or somebody else to do nothing more than drive around to communicate. So it's, a vital part of the integrating strategy.
And I think also too from the consumer's perspective, with technology. We know the importance of it from a provider side, but also from the consumer side and the patient portal access where they can get in and see their test or they can communicate with their provider so that they can better manage their care. So it's really exciting times for there's really no end to what we can do with this platform.
What have you learned from this journey that you'd like to share with others?
Going back to the culture, an integrated health system is not for everyone, even though we as an industry are, migrating towards that. You have to have a change of mindset. You have to be willing to look at the possibilities, get comfortable with change. Just because you have done something a certain way for a year or many years, you have to be comfortable with change, and you have to look in the mirror because you have to change as well. It's not the other person that needs to change. We all need to change, and it usually starts with us, and it starts with the leadership.
Thanks for joining us today.
Thanks for having us.
Thank you.
Appreciate it.
Appreciate it.
Thank you.